I think patients need to look for experience, reputation, and the interpersonal interaction they have with the doctor at the time of the consultation. First, experience. It's important for a patient to make sure that the doctor's done a few cases. I think most doctors learn most of their mistakes probably in the first 50 of anything they do, whether it's tonsillectomies, hair transplants, or heart surgeries. After 50, I think you typically have it, but you want to make sure the doctor's done a certain number of procedures. I don't know whether 50 is the right number, 500, maybe 1,000, but enough that they've established a track record of consistent results. And the problem with hair is, if you've only done 10, you don't have any results. And so, if you're going to see a doctor that's got any results, more than likely they've done plenty, and you're seeing some cases that were a year or two ago. And so, if a doctor has results to show you, typically they've got sufficient experience if those results look good to you, the patient. Second is doctor reputation. No doctor can make everybody happy. I can't even make my wife happy all the time. But doctors ought to be able to make most patients happy most of the time. And so by research you find out that everybody's mad at a certain doctor. Well, that may not be the guy for your job. If you find that most people are satisfied, and there are some people that are less satisfied, but you look at their results and maybe there's some weight on the patient's side and maybe on the doctor's, that may be worth you going and talking to the doctor. And if you find somebody that makes people happy most of the time, go and meet with that doctor. And then, what's your interpersonal interaction with? Do you feel like you're running through a machine assembly plant where you're just a widget? Or does the doctor take time to actually get to know you, know what your goals are going to be, and you get to see a procedure going on and know that it's not just a chop? And if that is reasonable to you and you like the doctor's approach, I don't mean you have to be friends with the doctor. But at least at our place, you need to know what my philosophy is, why I want to do what I want to do, and that ought to agree with you. If there's some mismatch, if you're focused on doing your crown and I won't quit talking about your front, well then we probably aren't destined to work together. If you and I can come up with the same goal, if your crown is an issue and your front's fine, well, I'm not going to try to talk you into doing something that you don't need, but I may suggest you spin your donor hair differently, and I'll have reasons for that, and we need to agree before making a decision to proceed with surgery on what the plan's going to be.